one of the reasons is that the ease with which a patient can file a case against the doctor. Suppose a patient is not happy with you, he can go to the nearest police station, file a police complaint against you. Then the case will come to the criminal courts. Then we have the consumer courts. Every district we have the consumer forums. Every state we have the state commissions. Then national level we have the national commission at New Delhi. The another important thing is the civil courts. Civil courts are government sector work in the doctors related cases later. Because consumer court patients in government sector patients consumers that are considered here. അവർക്ക് പൈസ ചെലവായില്ല എന്നുള്ള consideration ഉണ്ട്. Consumer എന്ന ഒരു definition പലപ്പോഴും വരില്ല. So the cases against the doctors of government sector goes to civil courts. Just recently, Kannur district തന്നെ ഒരു ഡോക്ടർക്കെതിരായിട്ട് ഒരു verdict വന്നിരുന്നു civil court. So don't be with the impression that government doctors are immune to medical litigations. Then we have the different commissions: Human Rights Commission, Child Rights Commission, Women's Commission. All these commissions can issue notices to doctors, and we are supposed to reply to them, and they will even take action against it. Then there is something called Lok Adalat. Lok Adalat means people's courts, which is run by the Medical Legal Society. That is mainly in Kozhikode, Kochi, and Trivandrum. There are also a lot of cases courts. Then finally we have the councils, medical councils. So the beauty of the professional protection scheme of Highway Kerala State Branch is that we cater to all these cases. See, there are so many indemnity schemes for doctors. Many insurance schemes have come up with indemnity schemes, medical indemnity schemes, saying that they will fight for the doctors. But they will not take up a case if there is a case that there is a criminal case. Suppose there is a hospital that died. But in all of these cases, professional protection scheme will help. The another reason for increasing number of medical litigations is the cost of the treatment. You know that every of the corporate hospitals, increasing treatment expenses, all these things have increased the treatment expenses. So what the people think is that the doctor is taking all this money, even though we are not getting any increase in the income. But people think the other way, and whenever they get a chance to get some money back, they will happily do that. Then overall problems like professional jealousy, negligence, lack of communications, the lack of infrastructure, patient overload, all this will contribute to increasing number of medical litigations. Few words about the Consumer Protection Act of 2019. Till 2019, we were following the Consumer Protection Act of 1986. In 2019, there were three important changes, which is very deleterious to our profession. First and foremost, till 1986, there was a capping of compensation. A consumer forum, a district level consumer forum, the maximum amount which can be awarded by that forum was 20 lakhs. Now that capping is taken away. Any amount can be awarded by any of the forums. That is one thing. Second thing is the amount which has to be submitted as the court deposit. Till 2019, only 35,000 rupees was needed to get a stay and go for an appeal. But that has been changed now. Now we have to deposit an amount equivalent to half the amount of the compensation award. Suppose the district forum awards an amount of 50 lakhs. So just to go for an appeal, the doctor should deposit 25 lakhs, half the amount of the compensation. That is one second thing. The most important thing is the removal of jurisdiction limitation. So till 2019, suppose an incident happens in a particular district. Suppose an incident happens in Kannur district, the case will come to the Kannur district forum, and then the doctors will have to find the case in the Kannur district. But that jurisdiction limitation has been removed. Now anybody can go anywhere and find a case. Suppose a patient from Bengal, Assam or Bihar comes to you, and if he is not happy with your care, they can go to their place, can go to Assam or Delhi and file a case against me. We have already received a case from Pondicherry, another case from Uttar Pradesh till now. The cases are going on. So these things are all very important things which you should know. And whenever there is a case against you, the main accusation is that you are negligent. What is medical negligence? Medical negligence is a type of behavior arising from lethargy of mind or thought thinking. The doctor may not be incompetent, but at that point of time, the doctor may have failed to exercise reasonable care and competence. So that's what is called negligence. And the negligence is of two types. First is the negligence out of commission, that is, we are supposed to do something and but fail to do that. So carrying out treatment beyond one's skills and care, injuries to wrong techniques, then error medications, alongside surgery. Suppose there is a fracture in one hand, you do surgery on the other hand, that comes in the negligence due to commission. Then acts of omission. We are supposed to do something but fail to do that. So abandoning the patient, failure to examine the patient properly, taking important histories and taking important consents, all this comes under acts of omission. Then a few words about the procedure in criminal cases. Because recently we heard in the newspapers, we heard that there will be immediate arrest of the doctors in a particular case. So we knew that it is not going to happen, but still the media was highlighting it, the doctors were panicked. But the thing is that whenever there is a police case or a criminal case, the investigating officer has to get a consent from the expert panel. So, the expert panel should examine the case and they should say that there is a gross negligence. So that's another important thing, that big expert panel, which is formed by a district medical officer, the subject expert, forensic expert, as well as public prosecutor. These four are the constituents of the expert panel. This expert panel should see the case and say that there is a gross negligence. Because Supreme Court has already given directions that they are supposed to see that whether there is a criminal negligence or a gross negligence. Many times such expert panels will give report as there was some negligence, there was some mistake was there. So see, please understand that this expert panel, what they are supposed to say is that whether there is a criminal negligence or not. So that is what, that many times it will be lacking from this expert panel report. Suppose this expert panel report comes against the doctor. The doctor has again he has the right to appeal. He can go to the apex body. So apex body consists of the district medical, DHS, DME vigilance, then director of medical education and director general of prosecution. Here also there will be subject expert will be there, and this body will most often will have a discussion with the patients as well as the doctor. Then they will come to a conclusion to see whether there was a criminal negligence or not. Suppose again this report comes against the doctor, then the case will proceed against the doctor in the court. But at this time only there will be arrest of the doctor. Arrest also don't think that they will come and arrest you from your office or anything like that. They will call you to the police station, they will record the arrest and send on station day. So that is the procedure in criminal court. So all these things may not happen in these three occasions, like POCSO Act, PNDT Act, as well as NTP Act, where there will be immediate arrest of the doctors if the proper information has not been given to the police. Coming to the prevention aspect, how to prevent litigations. Always make sure that you have proper qualifications, proper training. Have a good communication skill. Try to exercise reasonable care and competence. And documentation, very important. Unless and until you have proper documentation, you cannot defend any case in any of the courts. Avoid promises of complete cure of all illnesses, and always try to have an indemnity scheme, membership in an indemnity scheme, that is very important. Coming to documentations, make sure that your handwriting is legible so that others can read it. And it should be a routine to write some points, points in your operations. Just recently there was a case against a doctor from Naura. He was a physician, the case was a respiratory tract infection had come. patient give the history and he wrote all antibiotics, bronchodilators, antihistamines, everything. And during that time, the patient told that he is getting severe pain in the mandibular area, lightning pain he is getting. So doctor thought it may be something to do with trigeminal neuralgia or something like that. Then unfortunately he wrote carbamazepine tablet. Carbamazepine tablet twice a daily for 15 days he wrote. Then he sent the patient. And but this patient, the third or fourth day, developed severe drug allergy and went into Stephen Johnson syndrome. And the patient was admitted in a corporate hospital in Kochi. And then the case came. We saw the case sheet. Doctor wrote everything about cough, fever and everything. He didn't write anything about that severe pain in the patient experience. So there was no difference. Because you cannot tell difference that why he wrote carbamazepine. So that's the importance of writing the case sheet. Even in the OP sheets also, please write with the relevant notes. Always write the case sheets in such a way. Think that this has to be read about 10 years later by a judge or an advocate, and then they will decide upon the treatment you are given or care you are given. So that's the importance of writing case sheets. And you should have all the records in the IP charts. Very important is the nurse's record. Whenever there is a case comes against a doctor, the opposite advocate, what he sees is the nurse's record. Then, the doctor it is tallying with the nurse's record. Suppose a doctor has written the case sheet that I have seen the patient such and such time and I have advised such and such medicine. That has to be there in the doctor's nurse's record. Otherwise, what they will say is that all these things are fabricated. Doctor has written it later. Also, patient has something happened to the patient. It has been written later. Then all these drug charts are important. I am not going into details about all these things. When operation notes, discharge summaries, everything should be clearly written. Then consent is very important. That's one thing what we are seeing nowadays, many of the cases, whether the court is seeing whether proper consent is taken or not. Consent, please see that blanket consent has no value. Please see that you have written everything properly about each procedure the consent should be procedure specific. For each procedure, you should write separate consent. If you are taking a repeat procedure, then again that consent should be repeated. Even for blood transfusion, you are supposed to write consent. Unilaterally executed consents. The doctor also was supposed to sign the consent form. Not only the patient. Patient and doctor both should sign the consent. And patient has got the freedom to his consent at any time. Also, consent for illegal procedures is involved. Suppose there is an illegal backfire or suppose a criminal abortion. Just because the patient gave the consent, that has no value. And like already mentioned, be careful when you give certificate. There were a lot of problems some years back after giving certificates. Be careful. Coming to communication skills, we know that many times many alternate medicine fellows, they do so many things, but nothing will happen to them. Well, the thing is that they have got very good communication skills. They usually talk very nicely with the patient. See this picture, the empathy is shown to the patient. And always maintain a doctor style and always listen to your patient. Empathy is very important. And use clear language. Be conscious of non-verbal communications. Please have an eye contact with the patient, because nowadays all are using EMR. Our focus will be on the computer screens. Look at the patient. Some talk with the patient, looking at them, which will give a lot of confidence to you as well as the patient. See, and become a partner of quality of care with the patients. Be friendly to your patients. Be loving with them. Like Hippocrates said, treat often, cure sometimes, but comfort always. That should be our motto. So, with that, coming to professional protection scheme of IMA Kerala State, our aim is to help the members in case of litigations and harassments which occur when they are on duty. We also come up with the awareness programs also. BP scheme has basically our eligibility is that the doctor should be a member of IMA Kerala State Banks. Then only we can get membership in BP scheme. There are 3 types of membership. First one is a basic membership. That the amount which has to be given is 2,400. Then that will give a coverage of rupees 10 lakhs. Suppose a case comes against you and 10 lakhs is awarded, the whole thing will be given by the scheme. Also, whatever the advocate fee, everything will be taken up by the scheme. And if you are not happy with the coverage, you can take additional units. Additional units again, you can pay the same amount, which will give you another 10 lakhs coverage. You can take any number of additional units. If you want 3, suppose you have got 1 basic unit and 1 additional unit, the coverage will be 40 lakhs for if there are more cases and 20 lakhs for a single case. And if you want the coverage of 1 crore, you can take the enhanced coverage unit by paying rupees 12,000. You lose your membership if you fail to pay your membership fee in 30 days, and if you fabricate any of the documents or if the actions are unethical and it has been any ethical problems are there, then also you will lose the membership. You can renew your membership through online, through all details. I am not going to into details. Like that, we have got a hospital protection scheme also. That you can, in case you have got a clinic or a small hospital, you can take up this. You can become member of hospital protection scheme, and again the scheme will take all the legal responsibilities and will assist you in paying the compensation if it is awarded. Maximum coverage is rupees 10 lakhs. The eligibility is very important. All the doctors who are working in the hospital should be PT scheme members. So many times what happens, the hospital will be member, the case comes, the doctor will not be a member. In that case, the scheme will not be of any use because we will not give any coverage to such cases. So what to do if suppose say the legal notice comes to you? If the notice comes to you, what are you supposed to do? First and foremost, inform your district representative. We have got very experienced district representative. Kannur district, Dr. Dilnath is the district representative. He can contact you, he will tell you what exactly to be done. Then you send a notice, send an explanation to the scheme office, send the case sheet and send your membership details also. Then we will arrange the particular advocate who is there in your district. Then we will appoint you. Then please make sure that you contact the advocate, sign the wakalas, be in touch with him, discuss the case with him. So these things are all important because PP scheme is running almost 4,000 cases nowadays. So scheme cannot go after each and every case. So it's always important that the particular doctor should be in touch with the advocate and he should know about what is going on with the case. The another thing is that what first thing you usually do, you get is an advocate notice, a notice from the advocate. So please understand that 90% of the advocate notice will follow a case from the consumer court. So as soon as you get an advocate to a case, be ready to fight the case. Take care of the case sheet, keep it ready, all the investigation reports, everything should be ready, and always number the case sheet so that there should not be any tampering afterwards. Number the case sheet, take a copy with you and keep the original case sheet in the safe custody. Always remember that many times cases fail not because of negligence but because of documentary evidence to clear the allegations of negligence. So many times that is the problem with us. We might be correct, we might not have done anything wrong, but we don't have a proof to clear that. Near the secretary's residence. So this is the phone numbers. 9287274922 is the phone number of membership and renewal. You can contact us on IMA Periyar House, Alva. And for legal purposes, you can contact us on 9287274896. The office address for legal purposes is IMA House, Pala. Our email ID is cpsimakSB@gmail.com. So if you want any query or you want to send any of the details, you can send us on email. Again, important phone numbers for membership. Once again, 9287274922. Then for legal purposes, 9287274896. If you want to contact secretary, you can call me on 8111916263. And our email ID is eps@imakSB@gmail.com. So take home message, always have proper documentation and communicate well with your patient. Should have some awareness for the laws that govern our profession. നമുക്കറിയാം കുറച്ചാൾ മുമ്പ് ഒരു ഗൈനക്കോളജിസ്റ്റ് ഒരു മെറ്റേണൽ ഡെത്ത് ഉണ്ടായി ആരോ കേസ് കൊടുത്തു പേഷ്യന്റ് പോലീസ് ഉടനെ വരുമെന്ന് പറഞ്ഞ ഉടനെ she committed suicide. So please be aware with the laws that govern our profession, be ethical in our practice, and have a professional protections to membership like KPS. Thank you for the patience.